If you have back or lower back pain, it's important to understand what's happening and how serious it might be. Of course, you can't make a diagnosis on your own, but you can analyze your symptoms and get an idea of what type of problem you are dealing with. The first thing to decide is whether you need an MRI scan. If your back pain lasts for more than 2 weeks and isn't improving, do an MRI. If the pain comes and goes, but flare-ups have become more frequent 2, 3 or 4 times a year, it's also time to get an MRI. In general, any pain that is long-lasting or frequently recurring should be investigated. MRI provides the most accurate information about the underlying causes. Next, evaluate the intensity of your pain. Doctors use a visual analog scale from 1 to 10, where 1 mild discomfort, barely noticeable sensations, 10 unbearable pain comparable to kidney colic or labor pain. In cases such as spinal tumor, the pain is usually rated about 5 in the scale. Then assess whether your pain is centralized or radiating. If the pain stays only in your lower back and doesn't radiate anywhere, it's usually less serious and responds well to treatment. If the pain spreads down into the buttock or leg, that's a more concerning sign, often linked to nerve root compression. Now let's look at the pattern of pain. If your pain appears mostly in the morning or at night, when turning in bed or getting up, let's call it inflammatory or start-up pain, a sign of inflammation that shouldn't be ignored. If the pain appears after physical load, sitting too long, standing, lifting or carrying, it's a mechanical pain. Mechanical pain is generally benign and responds well to massage and physical therapy. You should also evaluate your tolerance to physical activity. How long can you sit before pain appears? If it's 2-3 hours, that's normal. If pain comes after 15 minutes, your spine doesn't tolerate sitting well. How long can you stand still? Normally, a person can stand for 1-2 hours. If pain appears after 10 minutes, your back struggles with static load. Does pain appears after light activity such as walking or shopping? That's also mechanical pain patterns. A very important indicator is your response to walking. If walking makes you feel better, that's a good sign. Such cases almost always respond to conservative non-surgical treatment. If walking makes the pain worse, especially if it radiates into the leg and forces you to stop and sit down, this may indicate a spinal canal stenosis, a surgical condition that requires medical evaluation. Another serious warning sign is numbness, tingling or shooting pain radiated from the lower back down to the legs, especially if it affects both sides. That suggests nerve compression and requires prompt diagnosis. Now let's briefly review the most common types of back pain. First, disc-related pain. Problems with intervertebral discs such as protrusions, cracks or herniations are most common between ages 30 and 50. Typical symptoms: pain radiates into the leg, especially when bending, for example, when trying to put on a sock. Disc pain usually lasts more than a month and takes a long time to heal because damaged discs regenerate slowly. Second, joint-related pain. Facet joint pain typically affects people over 40. It causes a constant dull ache with periodic flare-ups lasting 1-2 weeks. This pain usually responds well to anti-inflammatory medication and specific strengthening exercises. Third, myofascial pain. This condition is more common in younger patients, up to about 50-55 years old. The main features are muscle tightness, stiffness and pain after prolonged sitting or maintaining one posture. People with myofascial pain feel better when they move or change position. Flare-ups are short, usually 3-5 days, and don't respond well to painkillers but improve with massage, stretching and rehabilitation therapy. A simple way to differentiate these conditions is to ask, does walking make you feel better or worse? If it relieves your pain, that's a good sign, typical of mechanical or myofascial pain. If it makes things worse, pain increases with every step, that may indicate spinal canal stenosis, where the space for the nerves is narrowed, reducing blood flow and causing pulling pain into the back or legs. In general, self-assessment of back pain comes down to 3 main points. When did the pain start and how long has it lasted? Are there flare-ups and periodics of relief? Is the pain accompanied by numbness, tingling or shooting sensations? If your pain worsens with activity but is at rest, it's most likely mechanical. If it flares up at night or cold weather, it's probably joint related. And if it appears mostly during stress but disappears on weekends or vacations, it's likely myofascial, the mildest and most treatable form. The key point is not to ignore recurrent back pain. Even if it seems minor, understanding its nature helps you explain your symptoms clearly to your doctor, leading to an accurate diagnosis and effective treatment.